My name is Chris LeBlanc, Director of Engineering and Facilities for SouthCoast Health. So my role at SouthCoast Health is to run the facilities and operations for maintenance and regulatory readiness for all the hospitals. It's energy management, utilities management, regulatory readiness, pretty much every aspect of the facility we have responsibility for. Some of our business challenges were building comfort, energy awareness, energy consumption. We've sort of been in this mode since I started with SouthCoast to drive down our energy costs. Our maintenance team has primarily been in a break-fix type mode, very reactionary to requests that came down from the hospital, very work order based, very task driven. And with this new system, we're trying to get away from that mentality, more into the proactive and predictive behaviors.
On a daily basis, FacilityConneX helps us manage all the sites as one cohesive unit through the control system, so we can access the system from anywhere, interface with Chris, my director, who sees things come up in the system and can give direction either on the high level with future projects or directly into the maintenance staff on daily activities to correct some of these issues that we see.
It shows us the critical alarm values that are in the dashboard that show us the critical and maybe medium severity alarms. And it gives our staff the ability to quickly go look and see if there's a real issue or if it's maybe more of a programming thing that they need to attend to. The capabilities of the system are somewhat endless. I think one of the key things that we're really starting to get into right now is the training models that we can set up for the assets that'll make it easier for our frontline staff to really look at visually and just go, or look back historically at the trending and really try to identify maybe issues that have been going on or determine if the units are running the way they should be. After our initial training with the FacilityConneX, they showed us the iPad application. And I started to get familiar with it and noticed that there was a red alert that was in there that was a high severity alert. Noticed that it was probably a simple fix based on the description of what the issue was. So I took a snapshot of that image on my iPad and emailed it out to the lead HVAC team leader at one of our hospitals. And he quickly looked at it and determined that, you know, if I had this system years ago, this would have helped me through so many other issues. He actually quickly took that issue and went and resolved it, just with a couple of adjustments in the programming on our building management system. Our vision is to continue with this energy reduction, carbon footprint reduction, sustainability, and really becoming the industry leader in healthcare on energy savings.
With the Automatech system and through FacilityConneX, we can drive down our operational costs, and like we say, what gets measured gets improved, where we can quickly and easily quantify our entire system from one location and help us to plan accordingly with our budgets.
GE Prophecy and the industrial internet have really helped me and some of my other team members really take a close look on a single point basis within the GE Prophecy system. In other words, we have a hospital in Wareham, Massachusetts, a hospital in New Bedford, Massachusetts, and a hospital in Fall River, Massachusetts. And the hospitals are 20 miles apart. And this gives us, from any hospital or from any point where we are at that moment in time, we can get access into this system. Single point entry, simple to use, very easy to look at the data. And if I have a specific issue I'm looking at, I can drill right down into that hospital from anywhere and gain access to it. Some of the enhancements I see coming down the road with FacilityConneX is the energy dashboarding. It's really exciting for me to be able to see at a moment in time how our three main hospitals and our cancer center are performing on a consumption basis and as compared to budget on any given time in the month. It also helped us tremendously with budgeting. Being able to understand our live consumption data versus what we get in an invoice through a utility company, and really comparing that data and developing our budgets accordingly. And then the cost savings modeling that we're going to be looking at for repairs as part of this next step will really give us an idea and give the staff the idea what these repairs could cost us. And I think that'll show more buy-in on the facilities side for the staff to put a monetary value to that repair. So if they do it earlier, it's going to cost us less down the road, either through cost avoidance or through energy reduction. I also like the energy dashboard modeling that we're going to be getting into. That's going to provide a lot of insight for myself with budget modeling and trying to predict maybe what we're going to be using for energy throughout the month. And then the other thing that we're looking at too that's really getting me excited is the cost modeling for repairs. So as these alerts come into the system, we're going to try to show some pricing on what that may be costing us if we don't fix it.